Good evening and welcome to Just the News. I'm Faye. We have a lot packed in today on a Friday night. Let's get straight to it. The Centre has announced 48 cases of the Delta Plus variant of COVID-19 that have been detected from 45,000 samples collected across the country. Maharashtra has reported 21 cases, which is the highest in the country. 9 cases were found in Tamil Nadu, 7 in Madhya Pradesh, 3 in Kerala, 2 each in Punjab and Gujarat, 1 each in Andhra Pradesh, Odisha, Rajasthan, Jammu and Karnataka. The new Delta Plus variant is a mutation of the Delta variant that was considered largely responsible for the second wave of COVID. The Health Ministry has cautioned all of the states and asked them to take immediate action. Maharashtra's Health Minister Rajesh Tope has said that out of the 21 cases of the Delta Plus variant reported in the state, there has been one death. An 80-year-old woman with comorbidities has passed away. This was the first death due to the Delta Plus variant reported in the state of Maharashtra. The minister earlier said that all Delta Plus variant patients are being observed very closely and added that the state government is conducting aggressive contact tracing to control the spread of COVID. A Supreme Court appointed audit committee report has become a flashpoint between the Aam Aadmi Party and the BJP. The report says that the Delhi government grossly exaggerated the need for oxygen in Delhi during the second wave of COVID by 4 times as much as necessary, causing a crisis in other states. The report is part of an affidavit that has been placed before the Supreme Court by the Oxygen Task Force set up by the Supreme Court. Now, in this report, there is attached to it an interim report of the oxygen audit of Delhi that was conducted by a subcommittee appointed by the Supreme Court. So let me go through what was in this report, and there were quite a few points. Firstly, the task force, the oxygen audit task force for the country, has complemented the work done by the government of India, the central government, with respect to oxygen management for COVID-19. The National Task Force has said a series of proactive steps were taken by the government of India from March-April last year during the first wave of the pandemic, which helped quickly put in place mechanisms for enhanced production when the second wave hit the country. Secondly, the report questions the quality of data from the Delhi government with regard to the consumption of oxygen during the second wave. Thirdly, the report says the Delhi government and the government of India have used 2 different formula to arrive at how much oxygen is needed. So the Delhi government has counted all the hospital beds, including 100% of those beds that are not oxygenated. The central government has counted only 50% of the non-oxygen beds in order to calculate how much oxygen is necessary. The report justifies this move by saying that even some patients who are in oxygen beds might not be using the oxygen, so the Delhi government's calculation is wrong. The report also questions 4 specific hospitals in Delhi and their requested oxygen levels, saying it doesn't match the number of beds they have in those hospitals. So in that report, it basically recalculates the oxygen demand for the government of Delhi in a meeting on the 13th of May, where the Delhi government had asked for 1,140 MT of oxygen. The recalculation brings that number down to 289 MT of oxygen, after adjusting the numbers for the 4 hospitals and applying the Government of India formula. And so, in a conclusion, the report says this: the subgroup set up by the Supreme Court of Oxygen of Delhi, Audit of Delhi, notes a gross discrepancy in the actual consumption claims vis-a-vis the calculated consumption by formula of bed capacity. So, it's taken it down from 1,140 to 289 MT, according to this report. Now, the Supreme Court's audit panel was led by AIIMS Director Dr. Randeep Guleria, along with Delhi Government Principal Home Secretary, Max Healthcare Director Dr. Budhiraja, and Union Jal Shakti Ministry Joint Secretary Subodh Yadav. The committee has made a couple of other observations, including it says it's not sure how the Delhi government asked, based on these calculations, for 700 MT of oxygen. It says there was sufficient quantity of liquid medical oxygen in Delhi. The tankers in Delhi, in the hospitals and the tanker trucks were full. The slow decantation process, so the emptying process of the tankers, actually broke the supply chain, and Delhi has surplus oxygen, leading to supply problems in other states. It's a disaster waiting to happen. The BJP, in response to this report, has severely criticized the Aam Aadmi Party government over allegedly inflating its oxygen needs, while the Deputy Chief Minister of Delhi has said that no such report exists at all. Union Minister Prakash Javadekar has said on Twitter, and I quote, their demand for oxygen was 4 times more than what was needed, and because of that, the rest of the states had to bear the loss. One must learn from how to make noise from the Delhi government, end quote. Delhi Chief Minister Arvind Kejriwal tweeted, and I quote, I was guilty of fighting for 2 crore people so they can breathe while you were busy campaigning for the polls. I was awake all night arranging oxygen. I fought and pleaded for people to get oxygen. People have lost their loved ones due to the lack of oxygen. Don't call them liars, they will feel bad. Delhi Chief Minister Manish Sisodia has said no such report exists. We have spoken to several members of the committee. They have told us they have not signed or approved any such report. He has not made it clear, though, what action the Delhi government will take if such a fraudulent or a forged report is doing the rounds. Will they take any sort of action? We don't know just yet. The public spat between the central government and Twitter continues. Information Technology Minister Ravi Shankar Prasad today said he was locked out of his Twitter account for an hour because Twitter said he had allegedly violated the US copyright law. He tweeted, and I quote, Twitter denied access to my account for almost an hour. Alleged ground was a violation of the Digital Millennium Copyright Act of the USA. The minister also said that Twitter's actions were a gross violation of the new rules of the Information Technology Act because they failed to give him any notice before denying him access. Twitter India has responded saying the minister's account access was temporarily restricted due to a DMCA notice and the reference tweet has been withheld. As per our copyright policy, we respond to valid copyright complaints sent to us by the copyright owner. End quote. The Uttar Pradesh police has filed an FIR against The Wire, the digital news website, and 2 of its journalists for allegedly spreading false information and trying to spread communal tension through a video about the demolition of a mosque. The mosque, located in Barabanki district of Uttar Pradesh, the administration has said that this 100-year-old mosque was an illegal construction and the subdivisional magistrate court had ordered it to be demolished. The mosque authorities have refuted the claims. This is the 4th FIR that's been filed against The Wire by the Uttar Pradesh police in the last 14 months. The Kerala High Court has granted anticipatory bail to Lakshadweep filmmaker Aisha Sultana in the sedition case that was registered against her. This comes after Aisha Sultana had, in a televised panel discussion, said that the decision to lift COVID restrictions on the island of Lakshadweep is a bioweapon being used against the natives of the island. While dropping those charges, by giving her anticipatory bail, I beg your pardon, the court observed, and I quote, that there is no apparent indication in her statement which amounts to prejudicial assertions to national interest, nor does it propagate any class of persons against other persons. End quote. The Kerala Women's Commission chairperson MC Josephine has resigned from her position after she was criticized for insensitive comments she made against the victim of domestic violence during a live televised show. According to a report in the Indian Express, she was asked to explain her comments in a meeting of the CPM State Secretariat. Despite her clarification, many members of the Secretariat were unhappy still. So the report said at the party's insistence, Josephine submitted her resignation. Now, during that live show, one woman called in live and said she was a victim of domestic abuse. Josephine asked her if she had approached the police, to which the woman said that she hadn't told anyone yet. To which Josephine, who is a member of the Women's Commission, the chairperson of the Women's Commission, said, "Oh, then you suffer." She went on to say that if you don't want to live with your husband, you can get a good lawyer and approach the family court, get the dowry back and the compensation. These were the comments that upset people. India reported 51,667 COVID cases, 1,329 deaths in the last 24 hours. Kerala is the worst affected state, with 12,078 fresh cases being reported in the last 24 hours, followed by Maharashtra and Tamil Nadu. The recovery rate has increased to 96.66%. A viral video now shows a nurse from Bihar giving a man an empty injection while she was supposed to be giving him a vaccination. The video shows the nurse busy talking to people when she tears open a brand new syringe and then injects the man with nothing in the syringe. She's not seen filling anything into that syringe. either from a COVID vaccine or anything else. The district immunization officer has said the information about the video has come to him. Taking cognizance of negligence, Nurse Chanda Kumari has been removed from duty with immediate effect. Also, an explanation has been sought from her within the next 48 hours. The Mumbai police have now said that they've arrested a group of 6 people, including 2 who were running the Shivam hospital in Kandivali West, for allegedly conducting unauthorized vaccination drives across Mumbai. So far, 7 FIRs have been registered. According to the police, 2,000 people have received COVID vaccinations in 9 separately held private vaccination camps in Mumbai conducted by this hospital. The police believe these vaccines that were administered could be fake. Vishwas Patil, the Joint Commissioner of Police Law and Order, has said that their probe up till now has not established where the vaccines were sourced from, and prima facie these vaccines could be fake, but no scientific evidence exists to back it right now. Now, this comes on top of a case that's already before the Bombay High Court about a fraudulent vaccine drive that was conducted in the city of Mumbai. News coming in now from the world of business and economics. Depositors of the PMC Bank in Maharashtra won't be allowed to access their money at least until the end of this year. The RBI has decided to extend restrictions on this bank until the 31st of December. RBI said this is being done taking into account the time required for completion of reconstruction of the bank. Remember, PMC Bank was placed under restriction on the 23rd of September in 2019. So the depositors of this bank woke up one day and realized they don't have access to their money, which is in the bank, and they've now waited this long for access. It seems like it's going to take longer. Reliance Industries has lost nearly 1.3 lakh crore rupees of market cap in the last 2 sessions of trade because investors were disappointed with the announcements made in the company's 44th annual general meeting on Thursday. Now, shares fell 2.8% on Friday on the Bombay Stock Exchange, touching a 1-month low of 2,093 per share. The stock has been declining now for 4 straight sessions and has lost about 6.5% of its value. But we must remember that before those 4 days, the stock ran up 17% over the course of 6 weeks. So analysts are calling this a correction. We're not too worried about it. Now, these are the announcements that were made by Reliance during its AGM. It's going to launch a smartphone called the JioPhone Next, which is promised to be ultra cheap. It will be 5G, built in India, developed by Google and Reliance Jio together. It'll hit the shops apparently on the 10th of September. It also pledged to invest 75,000 crore rupees in clean energy. The thing that disappointed, though, according to reports, disappointed the investors was there were no timelines on WhatsApp Jio Mart. There was no timeline on the IPOs for Jio or for Reliance Retail, and no timeline for the organization of the oil to chemicals business that was going to be restructured. So that was the movement of Reliance, which is our biggest company by market cap in India right now. News coming in now from across the world. Israel, which has been leading one of the most successful vaccination drives in the world, has found a surge in the Delta variant in its country. Israel's health ministry has announced that people should start wearing masks indoors and outdoors again. The health ministry said masks will need to be worn starting Friday. Now, remember, the country had lifted almost all of its restrictions because cases were declining, and it managed to vaccinate most of its population as well. But earlier this week, Israel postponed the reopening of its entire country to vaccinated tourists in August, which was originally set to be July. Israel has reported 6,429 deaths altogether since the pandemic started. According to Reuters, the Philippines Food and Drug Agency today approved Bharat Biotech's Covaxin for emergency use in its country. Bharat Biotech has received full emergency authorization for Covaxin after the company completed all of its documentary requirements. This announcement was made by the FDA chief of the Philippines. The other countries that have approved Covaxin for use so far are Iran, Mauritius, Mexico, Nepal, Paraguay, and Zimbabwe. A quick look at an update coming in from the world of sports. Silverstone and Formula One have announced that the British Grand Prix in July will take place in front of a full capacity crowd of 140,000 people. Ticket holders will be asked in advance for either proof of a negative COVID test taken within the last 48 hours or of being fully vaccinated. The Grand Prix will be held on the 18th of July, a day before the COVID restrictions are set to be lifted in the UK. One piece of positive news before we leave you for today. The food delivery app Zomato has pledged to increase the number of women in its delivery fleet. Currently, the app has 0.5% of its entire delivery fleet as women, and they aim to increase that number to 10% by the end of this year. Zomato will also be adding self defense training in their onboarding process and will also add hygiene and safety kits. Women delivery agents will be able to rate restaurants on ease and safety and will also have a 24/7 helpline for emergencies. Well, that brings us to the end of this bulletin. Thank you for watching. We are uploading an entire whole story explaining what's happening or explaining that Supreme Court report that has come in that alleges that the Delhi government exaggerated its oxygen requirement. We've broken it down piece by piece, so do take a look at that report. But not letting you go before the quiz. So here's your quiz for today. It's a Friday night quiz. There's one big stock on the Indian Stock Exchange that has corrected 6.5%, it's 6.45% over the last 4 trading sessions. What is the name of that stock? Leave the answer in the comment section and I'll give you a thumbs up if you've got the answer right. Thank you so much for watching. Have a good weekend. Stay safe. Good night.